I think now it's good afternoon, and my name is Rosalba Ruiz, and I was told that I have to say that I work for the Alliance of Border Collaboratives. I'm a founding member of the Alliance of Border Collaboratives, of the Binational Breastfeeding Coalition, and I'm very happy to be here. I want to thank the organizers. And all morning, it's been very humbling because all the presentations have made me cry, and I feel really humbled, and I don't know if I'm going to do a good job. But so please bear with me because sometimes when I get really nervous, I stutter. And right now, I'm very terrified to be up here. So what I need to do is that I have to take you to the U.S.-Mexico border. So if I could please have my first presentation. So I need to take you this. This is why we have the map. So this is the U.S.-Mexico border. And it goes along, and I wish I had a clicker, from the Gulf of Mexico. It follows that red line. And and that's called the Rio Grande or the Rio Bravo, depending on which side of the border you're standing on. And then it ends in the Pacific Ocean. If you would walk through that red line, you're going to find a diverse terrain that ranges from very dense populated places to deserts that are uninhabitable. Horrible word for me to say. And really, I want to dare Donald Trump to build a wall on it. And it is the biggest international boundary in the world. It has an extension of 1,954 miles. It starts from San Diego, so perspective, San Diego, Tijuana to Brownsville, Matamoros. And why I'm here is because you have to understand that these are two countries. But in the morning, you can get up, get in your car, cross the bridge, go see your mom, go to church, go to eat, go to the doctor, go to the dentist, go to a party, go to have brunch with somebody, and you can come back in the same day. So we're very close-knit. And really, some people say that the border is a third country, okay? And so we are in the border, but we have very different things from the United States. We have very different things from Mexico. And but the thing that we also have is if you have AIDS, if you have diabetes, if you have whatever disease, they call the border a laboratory because in the border it explodes, okay? Because of the different dynamics that go there. So having said that, it's in one day, 700,000 legal crossings go through. In a year, it's 350 million crossings. They say that in one day, 5 million trucks and cars go through the border. And it's on both ways. And also I have to mention that in this border, there's a lot of crossing of drugs and guns, okay? So you have two countries, Mexico and Estados Unidos. You have 10 border states, 44 counties, 80 municipalities, and you have 16 pairs of sister cities. Next slide, please. This is a sister city where I live. It's El Paso and Juarez. They call it the Metroplex because in this city, it's in the middle of nowhere, in a desert, and there's, in the whole border, there's 12 million people. In El Paso and Juarez, you have 3 million people. Okay, here they call it the Metroplex. These are two independent countries, but they have a lot of commonalities, which are we have the same ancestry, the same families, the same traditions, food, drinks. They Corona and stuff like that. Dance, practices, religion. When the Pope came to Juarez, they closed the schools in El Paso, so it paralyzed both cities. That's how, this is another country, and they did this, you know? So that's where I come from, and, but I have to say that in the border, you're gonna have because the way it is, you're gonna have people that are very vibrant, dynamic, smart, and hardworking, because when you're talking about stereotypes, I remember when I was a little kid, and they would show the nopal, the cactus, with a lazy Mexican, like with a sombrero. And really, when we come into the United States, we're very hardworking. So this is a stereotype that we were put on. And so in the border, you're either born in the border or for some reason you ended up there, okay? So an example is my family. My father is a doctor that was born in Chihuahua, and my mother is a nurse that was born in Tucson, Arizona. My dad did his surgical residency in Tucson in the hospital where my mom was a surgical nurse. So one thing led to another. They fell in love. They got married, but my parents are very democratic, and they decided to live in Juarez because it was right in the middle between Chihuahua and Tucson. They didn't look at schools, they didn't look at the wind, they didn't look at anything. It was just in the middle. So both my parents are the youngest in their family, and they were from large families. And I was born in El Paso, and when I was 3 days old, I was brought to, you're going ahead, I was brought to Juarez. So I grew up there. And I don't remember, and all my family was out of town, right? I had cousins that were smaller than I, but I did see them, pero not that frequently. So when I grew up an only child, and my family was out, and I don't remember ever seeing anybody breastfeed their child. I didn't see it in the movies. I didn't see it in TV. I didn't hear about it in the radio. I just didn't hear it. I didn't hear it at school. When I was in school and they told us about the birds and the bees and reproduction health and puberty, they told us, and I remember this clearly, they say that you're going to get hair in different weird parts of your body. I'm like, where? I didn't know. And then they said, and little girls, their breasts are going to get bigger. Oh my God, But then I remember that all the girls, we went blushed, and the kids laughed, the boys. And really, if they would have told me there, what are the benefits, what it's made, what is the function, I would have remembered, Because when kids are so impressionable at that age, and they do listen, because we don't give kids credit that they're smart and they can assimilate it and can learn. So to me, one of the things that we should be working on is to, here in this table, we have to have people from the school system and telling them, you know what, we desperately need your help. So, but thank God, I went to medical school. In medical school, I heard about physiology and anatomy and the importance of breastfeeding. Then to me, it's oh my God, you know what, this is so important. And I said, to me, breastfeeding became a no-brainer. When I would have my babies, I was going to breastfeed no matter what, okay? So, yes, I have two children, and I have a 17-year-old boy and a little 6-year-old. And my 17-year-old, he could have been a poster child for breastfeeding. The minute we met, he took to the breast, okay? So I had a job that was very kind of demanding, and I had to travel a lot. So what I did is that I would travel with my mom and the baby, and I was in meetings like this, and then my breast would start to get big, and my mom knew because the baby was fussy. He would come down, she would just kind of peek in the water, and I would run out, I would breastfeed. When I was at work, I breastfed at work, and I breastfed in public. And when I breastfed in public, so I'm going to call it socially, because I didn't breastfeed him at work, but I lived in Juarez, and I worked in El Paso, okay? So I did it all. I pumped, I breastfed in public, and I did it, and I was kind of proud that I had breastfed my son. But then I had my daughter, and she's 6 years old, and I was like, this is a no-brainer. Again, I'm such a pro. I traveled with him. It's no biggie. My baby's going to be breastfed to a little girl. So they brought it to me, and she fell asleep. She wouldn't eat. And then the pediatrician kept saying, well, you're going to have to give her formula. I'm like, no. And I kind of lied that, yeah, she ate. And we went to the house, and I was bawling. I was crying because the baby wouldn't eat. So this really good friend of mine calls me, ¿Cómo estás? You had the baby, how are you? And I'm, oh my God, she's not eating. And she goes, mijita, I voy para allá. So she went to the house, and she and my husband took turns, and I would pump, and they would breastfeed my little girl with a syringe and dropper for 4 days and 4 nights. But thank God, at the 4th day, she got the breast. And she continued to take the breast until she was 4 years old. So then we went over that hump, and I was now, because of the violence in Juarez, I had to move, and I started living in El Paso. And I was a pro, and I started doing the same things, and I would breastfeed in public, and all of a sudden, people were looking, like, glaring at me and making faces at me and saying, like, really hurtful things to me, like, what's the matter with these people? I mean, I'm just feeding the baby, So being the way I am, I started looking up the information. So I found out my daughter was born in 2009, and my son was born in 2010. And this information is for 2010. In 2010, next slide, please. That's me having problems that people are looking weird at me. The next one, please. In Texas, people, when they say only ever breastfed, which means that they take the data at the hospital, which I think it's really biased. And it's 77.2. At 3 months in Texas, in that year, it was 38.9. At 6 months, it was 14.2. Oh my God, I said, women are not breastfeeding, okay? I did it, but I think that, and I was not aware of it because I didn't work on breastfeeding, so I assumed that women were breastfeeding at home, and I think that a lot of people that discard us think that these ladies make such a big thing, but really it's because they're thinking that women are breastfeeding in their homes, and they're not, So then I said, okay, so this is the United States. What about Mexico? Because that's where I breastfed my son, and everything was so cool and everything. So to my surprise, in Mexico is a country that breastfeeds the least in all of Latin America. 80% of women in Juarez are in the workforce, so they don't breastfeed. And we have a term that I'm going to call Americanizando or Americanizing, which is like we see in Mexico, they see the American movies, the iPhones, the music, and we copy what they do. And the women in the USA were not breastfeeding. The women in the in Mexico were not breastfeeding. So to me, it was like, I couldn't believe that this was happening, okay? But I've been working on diabetes for more than 16 years. And in diabetes, the numbers are staggering. The prevalence, the deaths are, unbelievable, and we haven't hit a plateau. It's still increasing because behavioral change is so hard. And so I started thinking, like, we have to change the approach. We have to do something different because what we're doing is not impacting. And then in the back of my mind, I'm thinking, because I'm really bothered for the fact that people are looking down on me, or even making me feel like I'm not professional because I'm breastfeeding. So I'm thinking all this, and then it kind of dawned to me, and I said, is there one thing that I could do to change the burden of diabetes and chronic diseases in the future that I could do right now? It's breastfeeding. So what I decided is that I was going to continue to work in diabetes, but I was now going to work in breastfeeding. So I was very lucky. I think that God is always where you are, and things happen for a reason, and I'm so happy I'm here, so I hope things happen. But I got together with a group of certified lactation experts that were very frustrated also because they knew all this and the information that you have, and women are not breastfeeding. So we got together and we formed the Binational Breastfeeding Coalition. Our main mission is that by the year 2022, and 2022 is because that's when we have 10 years of existence. So that by that year, all the babies that are born across the U.S.-Mexico border have the opportunity to be breastfed. And we firmly believe that in order to do that, you have to create the support systems in order for moms to breastfeed. So what are they? baby cafes, mother-friendly establishments, mother-friendly work sites, mother-friendly hospitals, depots, and milk banks, okay? And we have 4 strategies. What are those 4 strategies? They are awareness, they are education and training, research, because research we have to start doing, we have to be producing numbers and stuff like that, and of course of the border. And the final one is policy change. In awareness, we have done the Big Latch On, and we do presentation every time we can. And we've done those presentations at the local, at the regional, at the state, and then the national level. With education, we firmly, I mean, you should see these ladies. I mean, there's articles that come out, and they start reading and analyzing and stuff like that. So it's also for us, but also for the community and for other people that are working on breastfeeding. On research, we partnered with UTEP, which is University of Texas at El Paso, and that was a study that looked on what were the characteristics of women that actually do breastfeed. And the second one is looking at if we increase the intent of breastfeeding, when you talk to mothers or women about the important relationship between breastfeeding and breast cancer. And in policy, it's when you do the mother-friendly establishments and where the workplaces that talks to policy. And we had some major setbacks. I mean, there's other healthcare professionals that totally disregard us. We have people that work on chronic diseases. Well, I think it's changing, but like when we started, we have people that work in diabetes and chronic diseases in the community where we work, and they go out the community and they would say, for obesity prevention and chronic disease prevention, breastfeeding is a myth, okay? So it was hard enough, and then having other health authorities saying this, I mean, this was a big challenge. In the social, that women don't have those support networks, the way they see that breasts, it's okay if a mother breastfeeds, so it's so bad, but if you see Kim Kardashian or stuff like that, I mean, no, that's fine. So the social is very bad. So what do we do? What we do is you partner with those people that do want to work with you. You partner with the health, because there are people in chronic diseases and obesity that do think like you. You work with diabetes people, with anybody, and you have to change, and we have to not limit this room to people that are working in lactation. We have to work with people, smoking cessation, alcohol prevention, that you have to look at the patient holistically, and in any change, in any chance, like I was just with this man that's sitting next to me, and he was a pro the man. So why don't we do something with on Father's Day? Thank the dads for supporting breastfeeding, stuff like that. So here I'm to say that please partner and look at opportunities to work with somebody else. So my 17-year beautiful son, that's very smart and was breastfed. He gets after me, he gets mad at me, and he says, you know, Mom, you're imposing your ideas on women, because women have the right to, it's their body if they want to breastfeed or not. But I really believe that if you talk to a mother and you give them all the information and you provide their support network, they will breastfeed. To mothers that didn't breastfeed, I tell them, this is what I say, and this is what I said to my mom, because my mom didn't breastfeed me. And you imagine being my mom and not have breastfed me. So you should see, I mean, you should see her face. I mean, she gets, I know she feels really guilty that she didn't breastfeed me. But I told my mom, and this is what I tell people, I tell them, Mommy, at the time that you had me, and with the information that you had, and the circumstances that you were living, my mom was by herself, and my dad was working, and she was by herself. And I said, you took the decision that was best for you and for me. And there's something that I really like, and I am very emotional, but there's something that they use against us, which is this lactivist, like because we're so passionate and we're so visceral and stuff like that. But you know what? I've been thinking about that word, and hey, for 6 years, I lactated. And I'm very active in it, so I like the term. So if you want to throw it to me like in a bad way, I'm not going to get it in a bad way, because I am a lactivist. But what I don't like is the formula companies when they go and say that there's a mommy war going on. You know what? We're not here to fight mommies. We're here to help mommies. And who we have to fight is formula companies. And it gets me, it's really frustrating for me because I feel like we're 50 years back when they would say that smoking, there wasn't enough scientific evidence that smoking caused cancer. And most recently when they say that there's no such thing as global warming, you know? Well, excuse me, but I'm not gonna wait 50 years for change. I'm gonna start right now. And we also have to remember that we are in public health. And in public health, we have to start seeing what's going on and what is the data and start doing something. Because if we don't start in 20 years, people are going to look back and they say, hey, weren't you a lactation expert or weren't you working in public health? Why did this happen? So it's on us. What happens is on us. And so we have to start working. So I'm supposed to leave, and I took a little bit more time with a message to you that what is, of my experience, what I want to share with you is that we have to give 100%. You were looking at the statistics, and it's overwhelming. In the border where I'm from, women to 6 months breastfeed 16% in El Paso and 14% in Juarez. Okay, so we have to do more because nobody else is doing it. You have to stand your ground. In order to stand your ground, you have to know the information and the data. You have to be creative. Any way you can get the message out there, get it out there. We have to network and we have to partner, and we don't have to stop. You can't stop. You're here, síguele. You have to be doing it. And we've heard during the day that you have to have a voice. But you know whose voice that is? It's the little kids. It's the babies. They don't have a voice. We're their voice. And we always have to take into consideration that there's an Infante Declaration. Okay? So for myself and my National Breastfeeding Coalition, we are going to continue to work on trying to improve the health of the people that live in the border. And we're going to work vigorously and collectively to protect and promote breastfeeding as a natural and expected means of feeding human infant. Thank you very much.